Hi everyone, this is Dr. Jason Bruse from the Ogden Clinic. I wanted to take a minute today to talk about bunions. Many of you have perhaps seen, come across your social media feeds, advertisements about bunions and bunion surgery. There's a lot of national attention being directed towards bunions right now, and I wanted to take a minute to just talk about that. Bunions are a very complex problem, and we've been doing bunion surgery for decades. And we now have arrived at what I believe is really the best way to do a bunion surgery. I want to take a minute and show a few slides to demonstrate how complex a bunion is and the proper way to fix a bunion, because you very well may see advertisements talking about the right way and the wrong way to fix a bunion. And for the most part, I agree with those advertisements, but we can make some improvements on that, and I wanted to talk about that. So this slide demonstrates what a bunion is. A bunion is actually much more complex than most people realize. This is the first metatarsal bone. This is the big toe joint here. And a bunion is when the first metatarsal bone deviates away from the rest of the metatarsal bones here. And the way that we used to fix, and is still happening in a lot of places, is to fix this bunion by literally slicing off some of the bump right here, cutting the bone here and sliding the tip of the first metatarsal bone over. That's the wrong fix really for a bunion for most people. And when you hear about someone who's had a bunion surgery, who had a bad experience, and their bunion came back after they had a bunion surgery, that's why. There are studies that show with this particular surgery, up to 2 out of every 3 bunions done, the bunion returns. And I have seen that in my practice, and I believe in that, and I believe in those numbers. So that's not the proper way to fix most bunions, in my opinion. The right way to fix it, the problem with a bunion really is back here. This joint where the first metatarsal connects to the rest of the foot is too loose, and it's allowing the bone to migrate. And so the proper fix is not to just cut the bone and put a screw through it. The proper fix is to move back. Now, this is a slide that shows kind of the previous generation of doing this surgery, where we would put in a lot of screws, as you can see here, and a lot of plates, and realign the bone. But that was a lot of fixation, and this is not great either for patients. And so now we have kind of a new generation of being able to do this bunion surgery, and that's really what I wanted to talk about today. We are now able to do the proper bunion surgery for patients through small, minimal incisions. And we can do this in most cases in under a half an hour. In my opinion, this is really revolutionary, where we can take a bunion and we can put the bone in the right position, fix it. It should stay fixed for the rest of the patient's life. And we can do this with super strong fixation rods that are actually inside of bone. We can do it through small poke hole incisions, and I think that's really important. So this picture shows just the small incisions that we have to make to fix the bunion, and we pull the bones back where they belong and fix it. So here's a bunch of slides showing it, and I do these every week. So here's the unstable joint. You can see there's some deviation in this bone here, and this is the post-op x-ray. We're able to pull the bone back. We put this rod in through small poke hole incisions, and this will stay fixed the rest of the patient's life. Here's another one. This is again the pre-op x-ray. We are able to pull the bone in the right place. This bone is now positioned properly. The bump is gone. The bunion is now realigned, and we fixate it with this rod put directly in the bone. Now, I wanted to show this model. This shows actually what we're doing, and I demonstrate this every day to patients. This is the rod we can put inside of bone, and this is why this bunion surgery is revolutionary. We can place this really strong fixation inside of bone where there's nothing prominent. This area of the foot, if you put a lot of plates and screws like I showed in that other slide, can be very sensitive, and shoes and straps will rub on this area of the foot. So this fixation allows us to put a rod underneath the surface of the bone, and we can do this, like I said, with just a few small stab incisions in the skin. And we can do this in under a half an hour in many cases. And it really is revolutionary. This is a picture, I know it's graphic, but this shows the actual only small poke hole incisions we've done, and we were able to do the surgery very quickly. So again, more x-rays showing a pre-op. This is what we finished with. This is a patient 7 days after with small poke hole incisions, and there's the x-rays. Again, small incision. Here's the rod placed, and these are just small poke hole incisions. And this is what I believe is really something that's revolutionary. And so if you happen to see coming across your social media feed or even on TV or on YouTube talks about a surgery called Lapidus surgery or Lapiplasty surgery, talking about the right way to do a bunion surgery, I do agree with the notion of all that ad advertisement and that attention. I do agree that that is the right way to do the surgery. We just have improvements to do that surgery under a very small incision with stronger fixation, and we're getting really great results. And so I wanted to take a minute today to explain that to patients. I get the same questions every day about this, and I hope this has been helpful. If you would like to schedule a consultation with me and we can take x-rays and talk about your bunion and whether or not it should be fixed, you're welcome to come see me in my office in Layton. My phone number is 801-397-6150, and you can certainly find us online at ogdenclinic.com. Thank you.